Mr. Yasharovich, end February, I saw you, very formally to speak to journalists, and you said it is too early to draw conclusions on the severity of coronavirus. But now, a few weeks after that, could you draw a conclusion? What is happening right now in the world?
Well, we are still learning about the virus, but we do know more day by day as we go. We have seen that that virus is spreading quite fast, and we see that many people are being tested positive around the world now. This is obviously very concerning. At the same time, we have learned that with the strong public health measures of containment that some countries did put in place, it is possible to achieve results. We are still working on trying to see if there are any efficient medicine that already exists. There are a number of trials going on. We are working on vaccines as well. There are candidate vaccines that have been looked into. But again, at the same time, what is really important now for many countries as they cope with a big number of people who are falling sick is to try to contain or at least slow down the progression of the virus so their health systems can cope with the number of people who need hospitalization.
And for you as the WHO, what are the biggest challenges in this new epidemic?
Well, we see a number of challenges. One of them, obviously, is what will happen in countries that have weaker health systems. We have a number of countries around the world who are already facing different outbreaks of other diseases like cholera, like measles. We have countries in the world with a big prevalence of people living with HIV/AIDS. There is malnutrition in many places. There are countries that are in the conflict. So what will happen when virus comes there, and how they will be able to cope when we see that countries with stronger health systems have really problem to deal with the scope of the outbreak. There's also an issue of supplies, how we can make sure that health workers everywhere in the world get what they need. We see that there is an issue of personal protective equipment. There is an issue with laboratory testing. There is an issue with other supplies like ventilators and other material that is needed to provide that intensive care that people who develop severe illness will require. So we try to work with countries, with production companies to see how we can really ensure that health workers who are the real heroes today, they can get what they need.
Mr. Yasharovich, it is not the first time that there is an epidemic. You already coped with Ebola and also SARS and MERS and many other epidemics. Why still the problems are the same? Supply of medicine, lack of coordination between countries. Why everything remains the same?
Well, the progress has been made. We have to recognize that many countries have worked in previous years to improve their preparedness levels when it comes to health systems. Since the international health regulations have been agreed upon countries in 2005 and entered in force 2007, there was a specific agreement that all countries agreed to, is that they will try to improve their capacity to quickly detect and respond to outbreak of any disease. And many countries have done the progress. Unfortunately, many did not do enough. And what we were saying even before this happened is that we are not ready for the pandemic of this scale. So yes, we are better prepared that we were, let's say, 20 years ago. But as you can see today, we are still not fully prepared because we are facing these challenges. And we always go back to the same issue, is that countries have to invest in health. Without investing in health, it's difficult to expect to have everything that is needed when this happens. So maybe and hopefully this will be the lesson that we will learn once this is finished. That we really need to provide resources for health institutions, for hospitals, to health workers, to make sure that once something happens like this, we know exactly what we need to do immediately.
Mr. Yasharovich, 2, 3 weeks ago, people were worried about I mean, the possibility to find a vaccine and produce a vaccine. But now I hear from different people that they say, yeah, even if there is a vaccine, it is for rich countries, and then maybe for poor countries. What is your role as WHO to prevent this? To make it very a democratic way of preventing the epidemic? Because as we know, corona is very democratic in spreading.
Exactly. This is the common enemy. It is affecting everyone, poor and rich. And this is something that will be looked into, and WHO will surely look for ways that whatever we have at our disposal is being provided to everyone. Unfortunately, we are still away from vaccines, so we need another year or year and a half to get to have a vaccine, because there are different stages. First, we have to develop the vaccine itself. Then it has to go through trials, to clinical trials. We cannot really shortcut too much the process, because we want vaccine that is efficient, but that it's also safe for people. And then we need to look into mass production, how we can produce a big number of doses of that vaccine. And then during that process, obviously, WHO will work with countries, with partners, to see what would be the best way. But again, we are looking into something that it's months from now. What countries really need to focus now is really on a basic public health measures, such as identifying people, testing them, providing care to them, and then trying to find the contacts and try really to go after the virus. What we are seeing is that many countries are introducing measures that can slow down and should slow down the transmission, such as physical distancing, avoiding gatherings and mass events, to get some time really to health workers to be able to provide the care for everyone who needs.
Yeah, you spoke about cooperation with governments. Where or in which region you have difficulty to convince the leaders to cooperate in this global fight?
Well, we have really no issues with cooperation with governments, and because every government in the world really wants to protect its citizens. And they are looking into best way to do it. WHO is issuing guidance that are general guidance on different aspects of this response. For example, clinical management of people who are sick, laboratory testing, infection prevention and control measures, risk communication. And then countries adapt those guidance to their own context. It's not the same thing if a country has just few people who are infected with COVID-19 and others who have already thousands of people in hospitals. So countries adapt WHO guidance according to their own situation and their own analysis. So we do communicate with every country in the world, and we understand that every country in the world is put in a very difficult situation now, because this is not only health crisis, it's an economical crisis, it's a social issue as well, and countries are doing their best, really. We don't know about any country who wouldn't like to do the best for their citizens.
Are you aware about, the adaptation of your guidelines in Kurdistan region? And are you happy with what they are now doing, the lockdown and everything?
Well, again, I may not have a particular really information on particular countries right now, but we hope really that health actors and health providers everywhere, well, by now they know what is going on. Our guidance and guidelines are public and available to everyone. That every health authority in every country managed to prepare some plans. So what we will do if we get, let's say, 100 infected people, where are we going to put them? Do we have enough of beds? Do we have enough of isolation units? Do we have enough of material for those who will need clinical care? Do we have people who can go and trace? So this is the question for every health authority in the world. And again, those health authorities need support from the government. And this is really what was the key, is that what we have seen at the beginning is that, this is the health issue, so we just leave it to the Ministry of Health and hospitals to deal with. But this is much bigger now. So the whole government's approach, all of the government approach has to be put in place, meaning that governments have to put at the disposal of their health departments, ministries of health, and health authorities everything they can, because this cannot be just left down to healthcare workers.
Yeah, Mr. Yasharovich, let's speak about the day after Corona, when this will end. We know the world will not be the same as now. What does that mean for you, for WHO?
Well, we are really focusing on the present right now. We don't know how long this pandemic will go. We don't know what direction it can take. It is important really to try to save as many lives as possible today. However, like after any big crisis in the world, there will be lessons that will be learned for WHO, but also for the world as a whole, for public health community, and as our director for Mercies, Dr. Mike Ryan, always says, there is never 100% good response to outbreak. There will be mistakes. Mistakes are being made. This is a part of the process, but we should move. We should try to help as much as we can today. And yes, one day we will all sit down and see what could have been done better. And that's this work on preparedness that hopefully will take place.
Many people say after this Corona, we discover that we need a more powerful WHO and we need a unified health system in the world. Do you agree?
Well, we at WHO, we are doing our best, but WHO is a part of the United Nations systems. We are as powerful as member states want us to be powerful. So we serve all countries in the world, but ultimately it's the countries who make decisions and ask WHO to do one thing or another. We always advocated for a system where there will be coordination among countries, and I mentioned international health regulations. That is one of the instruments that sets the mechanism on how countries will cooperate in the case of the public health emergencies, and it is working, to be honest. But again, we have to recognize that countries have their own specificities, that the context is different in different countries, so the blanket approach would maybe not be working as well. So I think it is important that WHO provides what it's made to do, and that's advice and scientifically based guidance. But we have to recognize that countries ultimately have sovereignty, and that they may choose the course of action that seems most appropriate to them.
But do you agree with me that big countries in past underestimated your role in world health situation?
Well, I think people do turn to WHO in times of crisis, and we see this since a couple of weeks, for example, just the number of people who are watching WHO on social media, number of people who are watching our regular press conferences, number of people who are asking for the information from WHO increased like 5 or 6 folds. So that shows that people do turn to WHO, see WHO as a credible source of information. And obviously, this is something that we want to be seen as, and that we will continue in that direction.
My last question, Mr. Yasharovich. Do you know when this ends, this epidemic? I mean, as WHO, do you have estimations?
No, we don't really do predictions at WHO. There are a number of modeling that has been done around the world, and you can hear that there was a modeling that would say that there would be so many cases in so many months, and that modeling is important, and we work with a number of people who are doing these things because it's important for planning purposes. And every hospital, for example, have to have different scenarios to say, oh, what if we get 10, if we get 100, if we get 1,000 people, what do we do? But that's not a prediction. So we don't do predictions at WHO. But one thing we know is that how big impact this outbreak will have on people's lives depends directly on the action that will be taken by all of us. So better we do today, the less people will die and better we will all be.